Welcome to another edition of Dan Frequently Asked Questions. In this edition, we'll be addressing a question about diving after endometriosis surgery. What is it? Keep watching. Okay, so we got a question from someone who had undergone endometriosis surgery. Now, what is endometriosis? For those of you that don't know, what can happen during the period that a person menstruates is that there can actually be blood going down the tubes of the uterus. In other words, not only leaving the vagina, but going down the tubes of the uterus and ultimately actually setting up tissue in other parts of the pelvic lining or the lower pelvic areas, and sometimes even in and around the bowels. Such individuals often have pain during intercourse, and of course it is especially problematic during the times of menstruation, and there are some concerns about whether or not they'll be able to have children. In general, people who have endometriosis are encouraged to start their families early because the condition not only can sometimes be alleviated with the pregnancy, but the chances that they ultimately can't have children then, of course, is no longer that big of an issue. Now, endometriosis surgery is not equal to everybody. In some cases, it literally only involves removing the lining of the uterus. So imagine the uterus like a pear, pears in the fruit, and you literally have a canal inside the middle of the pear which represents where the lining of the uterus is, that you now have abnormal bubbles in those areas that become painful during menstruation. What they sometimes do is called an ablation. In other words, they literally use either chemicals or heat to essentially destroy that entire area of lining, which in practical terms means that even though your body has all the hormones of menstruation, the uterus does not respond. Secondly, there is suppression of menstruation, and some individuals choose to go on long-acting contraceptive treatment such as injectable progesterone, which prevents menstruation for periods of up to 3 months and is then renewed and can be maintained virtually indefinitely. Now, I'm not a gynecologist and I'm not going to pretend to be one, but those are some of the basic issues. So the big question to ask for an individual who has had the surgery is, 1, has the surgery resolved? And generally we say 6 months is the time it takes for most surgical procedures to get back to normal. 2, are you on any medication that could pose a problem with diving? And that's unlikely, but we do like people to stabilize for a period of at least a month or again 6 weeks before carrying on with further diving. And then 3, is there perhaps an area where the endometriosis surgery occurred that has now caused an additional complication that relates to diving? In other words, are there now areas in the intestines, pelvic and abdominal area that can't adjust to pressure in the way they used to, which can happen if, for instance, sometimes the intestines stick to one another and one can actually get gas accumulation. So those are some of the considerations. In simplest terms, if it doesn't hurt, it's probably not going to be a problem. But it's best to get a gynecologist's opinion, and certainly that of a diving physician, which I've just given based on the simplistic information of the question, and I hope that it is of use to you. So until next time, safe diving.